Okay, so let's talk about catheter care. If you happen to get the skill for catheter care on a female resident, let's talk about how to do that and what the things you should avoid with catheter care. Okay, so catheter care is a pretty common one. I gotta say that 80% of the people get that skill. Okay, again, you don't know until you get to your exam whether or not you're gonna have that skill, but catheter care is definitely one of the most popular ones that's chosen. Okay, so let's talk about a few things that will help you get through that smoothly and hopefully get you to pass your skills portion of your exam. Okay, so I'm Eric. I'm a registered nurse. I own Love Reigns Medical Training Center here in Gainesville, and I also teach the CNA exam prep course. Okay, so I was a CNA myself. I was an LPN, and I'm now an RN. So I know all the things. I've been in every field. I'm not just somebody teaching this. I actually did these things. Okay, so let's talk about catheter care and the important things that you should remember the most. Okay, so catheter care is important because, for one, I need you to understand that every decision you make about catheter care is based on the possibility that you could pull that catheter out. Okay, everything that they're watching for is to avoid you from pulling out the catheter. Okay, the catheter is inserted through the meatus. Okay, that is your pee hole. Okay, I need to keep this as simple as I can. If you feeling offended, I'm gonna need you to exit the video. Okay, but we're talking about grown people stuff, and it's just me letting you know why catheter care is so important. Okay, the catheter is inserted in through the meatus, which is your pee hole, right? They put it's a balloon inserted in there. So basically they fill up the port with like a fluid to blow that catheter up. So basically it's going to be a balloon about this big, about that wide, okay? Pretty much on the inside of the pee hole, okay? And I'm saying pee hole, the medical term is meatus, okay? So the goal for you when you're doing catheter care is that you don't pull it out. They just want to know that you're not going to cause an injury to this patient while you're providing catheter care. Catheter care is super important because that is a way to cut down on opportunity for infection to go into the bladder, right? The catheter is going straight into the meatus, into the bladder. That's where it's going to help you pee. To understand the purpose of a catheter, the catheter is to help people who are unable to void, whatever the reason may be. Void meaning urinate, okay? That is the purpose of the catheter being placed. You could have been under anesthesia, whatever the reason. You may have urinary retention, so there's multiple different things that could cause you to have a need for a catheter. But ultimately, all you care about is how to not hurt the patient during your skill and in real life if you are assigned to a patient with a catheter, okay? So the goal of everything that you're going to do in this skill is to avoid pulling the catheter from them and causing infection. Those are the two things I would say the most important is that you don't pull out that Foley catheter and that you don't cause increase the chance of infection to go into the bladder, okay? So this is what the nurse evaluator is going to be watching you for, okay? She's going to be watching you for multiple things, but those are the two most important things, okay? Those are the things I'm telling you will cause you to fail that test, okay? I'm telling you. So my goal is to teach you what will fail you. That's what we care about. What I do not need to do, okay? So she's looking for that. So during catheter care, I need to make sure when you're doing catheter care that you are, so there's two parts to catheter care for the most part, right? Is that when you're cleaning the catheter and when you're cleaning the peri area. The peri area is everything else that, outside of the catheter, private area, right? That's called the perineal area, okay? So what they're doing is they're going to watch the see. So basically, I need to make sure that you know that when you're doing the catheter care, that you hold on to that catheter at the meatus. Hold on a second. Foley bag. This is the Foley bag, and this is the catheter itself. I said, let me go get it. It may help you. This is the part that's inserted into the meatus. And this portion here is going to blow up into a balloon about this size. So once we push water into this area here, it's going to cause this to go into a balloon, which is going to help you. That's how it stays in. That way, when you in and out, so that part of it, this part will be inside of the meatus. So this is the side you're going to see, this part. So this will be in, we'll use my fingers. This side is going to be inside of the meatus, and this will be the part that you're going to be cleaning, okay? So for the most part, I want you to know that's what that is into. So when you're doing catheter care, they're going to look to see that you pinch that area outside here as you're cleaning, okay? That's what they're looking for, that you hold on to it. The purpose of that being so important is that if you hold it while you're pulling on here, you won't pull that out. That's just to keep it stable, okay? That's why it's important that you understand how the catheter works, what the purpose of it is, and what they're looking for. Because I think it helps you to understand the reasoning behind it, which is why I like to teach from a point of what you should not never do, okay? They want to know that you're not going to cause an injury. That's what they care about more than every skill, every question, every written question is going to look to see that you are not going to be cause a harm to the patient. That's what the Board of Nursing cares about, Prometric cares about. Are you going to cause an injury to the person you're caring for? That is all they care about. And you got to know the things that you need to avoid to not do that, okay? So again, we're going to clean the catheter. So I'm going to make this quicker because I want to get through this. But what I want you to know is that pretty much it's 4 parts. You're going to clean the catheter 4 times, and then you're going to clean the actual peri area 5 times. So there's 2 steps. When you're cleaning a Foley catheter, you're going to wet 4 corners, okay? I just need you to know that the infection control part comes from making sure that you go from clean to dirty and that you don't cross-contaminate that washcloth. So while you're using those corners, that you only use that one corner once. If you use that same corner on 2 spots, you will fail, okay? They want to make sure that the reason why we have 4 corners is that you move that corner down as you go through each spot. That we don't use that same one to touch the same space twice. Or anywhere. Don't touch anywhere twice with the same spot on the washcloth. That's what they're looking for, okay? So I just need you to understand about catheter care. Part 5 is the same thing. Like when you have to do the washcloth 5 times, you wet the washcloth. So step 1 is you wet the washcloth 4 times. Step 2 is you wet the washcloth 5 times. And that's just the corners, okay? And then when you clean, you make sure you go straight down, top to bottom, clean the dirty, right? Don't come back up. I'm telling you, you're going to bring dirty up, infection, bacteria into the bladder. While you're doing your care, just also make sure that you're aware of where your catheter is on the bed and that you're that as you're doing care, you just kind of look to make sure, because they're going to make sure that you're watching the fact. Make